Hello, thank you for attending this session. Today's presentation is a result of a collaboration with the Alabama State Nurses Association. We are thankful for the opportunity to share this information with you. I'm Dr. Tracy Dick. Today's presentation is entitled COVID Pandemic Effects on Alabama Nursing Workforce. The presenters declare no financial conflicts of interest. Nurses constitute the largest segment of the healthcare workforce and work in many different settings. According to the Alabama Board of Nursing website, there are currently approximately 81,000 registered nurses, 14,000 LPNs, and just under 8,400 advanced practice nurses that are licensed to work in Alabama. The health and sustainability of our nursing workforce is crucial to ensuring that the people of Alabama receive the highest quality of care. Thus, understanding and addressing the impact of the COVID-19 pandemic on our nursing workforce is critical to the functioning of our healthcare system. For this project, we were particularly interested in exploring how nurses representing different practice areas would report their experiences, and if those experiences would be different. The purpose of this presentation is to describe Alabama nurses' COVID-19 pandemic experiences by practice area. The Alabama State Nurses Association has conducted a series of anonymous surveys during the COVID-19 pandemic. These surveys have been distributed via SurveyMonkey to ASNA members as well as other nurses that have provided email information to the organization sometime in the past. The link to the surveys can also be shared by recipients with other nurses who might not have received the survey directly from ASNA. For this presentation, the analysis reported is from a survey distribution which took place between July 2020 and February 2021. The data collected was reviewed by ASNA, but then also shared with our UAB School of Nursing team for a secondary analysis and detailed summarization of the qualitative data that participants provided. A total of 2,561 nurses accessed the survey. 96% of those provided practice area information. Since the interest of our team was to determine if there were different experiences reported by nurses working in different areas, the respondents were categorized into the following practice areas: acute care, ICU, long-term care, assisted living, outpatient, and other. The other category was comprised of those respondents that provided practice area information which did not have enough specificity to allow categorization into one of the other groups. For example, if a nurse wrote cardiology, we were unable to determine whether that nurse worked in a cardiology ICU, cardiology step-down unit, or cardiology outpatient clinic. In order to provide the most reliable data analysis results, our team chose to situate these responses within a separate category, which we report as Other. The data for this project were collected via a survey. The survey contained 15 items that collected both quantitative and qualitative data. The focus of analysis was to evaluate the responses by practice area, and the analysis methods used were descriptive statistics for the quantitative portion, and then content analysis for the qualitative portion. One thing to note, examples of participant quotes will be shared extensively in this presentation. In qualitative analysis, it is important to represent the words of the participant as they are stated. For this project, the words shared were in written form. In order to maintain the integrity of reporting our results, participant comments are included as is, meaning there were intentionally no corrections made for spelling, grammar, etc. Based upon survey responses, we report today on a division of practice area as specified on this slide. 33% of nurses listed their practice area as inpatient acute. 13% listed their practice area as inpatient ICU. 6% represented the long-term care and assisted living work areas. 38 reported or were categorized as other, and 9% were categorized as outpatient nurses. Survey question number 1 asked, at this point in the pandemic, how would you rank your stress level? This was a select all that apply question. For this question, over 50% of the nurses that were categorized as ICU nurses reported feeling undervalued and exhausted or stressed to the core. The key on the right side of the slide includes the verbiage of the actual potential answers that respondents could choose from. Acute care nurses reported the same, but with a slightly lower percentage seen in that group. As you can see from the figure, exhausted, stressed to the core, and feeling undervalued were also reported by between 40 to 50% of nurses working in long-term care assisted living facilities. Outpatient nurses had the largest percentage of respondents that chose, my stress is improving now that the vaccines are here. For question number 1, there was also a response option labeled Other, which offered the participant an opportunity to enter free text. Here are some example quotes that were collected from that selection. Theme COVID hazard pay. One ICU nurse stated, we have been asked to do more and more. We go to save and help as many as we can and are given very little to nothing in return. We risk our lives and our families' lives to help others, but with no compensation for our efforts. We are told we are abandoning our state when we leave to travel so that we can be fairly compensated. What is happening to us, the nurses, is wrong on so many levels. There are not many days when I leave work emotionally and physically exhausted only to lay awake struggling to think of how I can make it better for my patients. Another thing was staffing and workload. One acute care nurse stated, floor nurses are expected to work extra hours and take more COVID patients than recommended, and the nurses are bullied to feel that if you don't take on these patients, that you tell them you can't properly take care of, then your job is threatened. The common term floating around is a little care is better than none, which is not what I feel is the best attitude. Question number 2 of the survey asked, nurses are in the first tier of vaccine distribution. Do you plan to take the vaccine as soon as it becomes available? Over 40% of the respondents who worked in outpatient, long-term care assisted, ICU, or acute care areas reported that they had already had at least one dose of the vaccine. The group categorized as other had a report of over 40% that yes, they did plan to take the vaccine as soon as possible. Question number 3 asked, how would you rank the current PPE supply situation in your work setting? Choose the response that best fits your experience. Of note is there was also an option to select Other and have the ability to enter free text. The quantitative results were interesting on this question. As you can see from the figure, all areas had the highest percentage of participants choose the excellent option. But the second highest percentage seen was of those respondents that answered shortage. Of the respondents that chose the other option and provided some free text, the following top themes were identified, and these themes are shown in this figure in order. So as you can see, the number 1 theme in the inpatient ICU was that at that point in time, there was adequate PPE. But then the second theme identified in the inpatient ICU was that there was a lot of reuse recurring for the PPE. Looking across the figure, you'll note the same top 2 themes, though they may differ a little bit in order. The acute care nurses reported reusing as their top theme with adequate as number 2, the outpatient reusing with adequate as number 2, long-term care assisted as adequate number 1 theme, number 2 reusing, and those listed as the other categorization as adequate for their number 1 theme. Here are some examples of quotes that were placed within the associated theme categories. Adequate. We have what we need. Reusing. Hate using an N95 that has been disinfected for reuse. Just doesn't feel safe. Inferior quality. We wear trash bag material in our COVID rooms. Shortage of gloves. We have enough masks but are being asked to conserve gloves, which is going to lead to highly unsafe practice. Personal purchase. My unit was recently asked by our manager if we wanted to purchase an N95 mask. Seriously? Who does this? Using surgical masks only. We are being told to use surgical masks only, and the N95s are for staff members with health risks. PPE is locked up. PPE locked in a room where only security has key. Guess you hope security is readily available. Question 4 asked, do you feel like your employer is doing everything necessary to protect you? Over 50% of the nurses associated with outpatient, other, or long-term care assisted living facilities reported yes. However, or in comparison, those in the ICU are classified as acute care nurses. Over 50% of those reported no. Question number 5 stated, my perception is that my facility has a shortage of nurses. Over 70% of the ICU nurses strongly agreed with that statement, with between 60 and 70% of those in acute care or long-term care assisted living facilities strongly agreeing as well. Question number 6 stated, we need retired nurses and new grads to fill needs in certain practice areas. Of those nurses that responded strongly agree, the majority were those that are affiliated with long-term care assisted living area. Second in the strongly agree category were acute care nurses, then ICU, and then those listed as others, lastly outpatients. However, the outpatient nurses were the leading group with over 40% that chose the agree option. Question 7 stated, our emergency department has been overwhelmed. As you can see from the figure, the ICU and acute care nurses, greater than 50% of them strongly agreed with this statement. Question number 8 stated, I have been able to maintain a reasonable amount of self-care, diet, exercise, relaxation, and sleep. Over 40% of the nurses affiliated with ICU setting chose disagree, while an additional 25 to 30% chose strongly disagree. Interestingly enough, the long-term care assisted care nurses reflected the same pattern. Between 35% and 40% chose disagree, with 25 to 30% choosing strongly disagree. Acute care nurses also chose these options. Between 30 and 35% of acute care nurses disagree, with 20 to 25 choosing strongly disagree. Now, if you look at the figure initially on the agree statements, you would see that the outpatient nurses are the most represented there, with that area between 35 and 40% choosing agree. However, if you look back up at the strongly disagree and disagree, you'll see that there are large percentages of outpatient nurses that chose those options as well. Question 9 stated, our state elected officials have done a great job dealing with this crisis. The majority of nurses in each work area chose either neither agree nor disagree, or tended to choose the disagree or strongly agree option. Question 10 stated, our federal elected officials have done a great job dealing with this crisis. Similar to the previous question, representation of all groups was primarily identified at the neither agree nor disagree level or the strongly disagree response. Question number 11 asked, does it bother you to work with travel nurses who receive higher pay for the same job? Of note is that there was also an option to select other and have the ability to enter free text. 50% of acute care nurses answered yes to that question, and between 40 and 50% of the ICU and long-term care assisted nurses also answered yes. All categories of nurses, however, were represented, as the yes answer was chosen by between 30 and 40% of those affiliated with outpatient or other areas. What's really interesting, however, is to notice the numbers of nurses that chose I've considered travel nursing, and we'll take a look at that a little bit more on the next slide. For those that chose the other option for question 11, the following top themes were identified: travel nurse, same job should equal same pay, all nurses need pay raise, and we appreciate them. Here are some examples of quotes that contributed to our overlying themes. Theme of travel nurse: I left to become a traveler due to higher pay. Result of administration management issues: we wouldn't have to pay travel nurses if our institution compensated us fairly. We need travel nurses because all of our staff are leaving to travel. That's ridiculous to me. Appreciation: I'm just grateful for the help. Same job should equal same pay. Our hospitals should be paying their staff the same as travel nurses. We are doing the same job they are in the same overworked and understaffed conditions. Demonstrates lack of appreciation. No, we need the help, but I would like the hospital that I work at to value me similarly. They are willing to pay thousands of dollars a week on travel nurses and can't even give me a raise, consistent bonus. All nurses need a pay raise. Alabama needs to pay nurses to scale with the rest of our nation. Question number 12 asked, what's your top concern with COVID-19? And this was an open response question, so all of the data collected was analyzed as qualitative data. Here you see the top themes that we identified. Again, the themes are listed in order 1 through 5 for each separate area. But the top themes are similar in areas, as you'll see. The top theme overall seems to be infection risk, while the secondary theme is staffing and workload. Here again we share some quotes that contributed to the formation of the themes identified. Infection risk: people returning to work too soon and contaminating others, having to use same break room with other nurses, having to share equipment, COVID population extending throughout the hospital instead of to a confined area, not enough testing of incoming patients, visitors, etc., having to be exposed to visitors who have no regard for our safety, not having employees tested weekly so we can prevent an outbreak between us, not being told who you have an exposure when management is aware so you can take better precautions around your family members. This list could go on and on. Staffing workload: we are running with a skeleton crew of nurses on our COVID unit. It seems like every week when I get back to work, we are being asked to take more and more patients. It is exhausting to have COVID patients and have to don and doff PPE for every patient and assume total care as the rooms are limited to nursing personnel and doctors. It is wearing many of us out. Theme vaccine: getting everyone vaccinated as quickly as possible. Safety is always first, but I also hope this vaccine isn't mandated. I will have to quit nursing. Not ready to take it yet. Theme public response disregard: the public not taking it serious, not wearing a mask, and pretty much making fun of us healthcare workers who do wear masks and promote infection control. Until the public realizes they are responsible for slowing the spread, it will not get better. And virus control: continued high numbers now in rural areas, children returning to school, and does that mean more outbreaks? Question number 13 asked, what has been the toughest experience you've faced emotionally during this pandemic? This was another open response question, and here you see the top themes we identified. Across the board, the number one theme identified was amount of death. Secondly, there was a lot of representation from nurses about concern for personal mental health. Theme, amount of death. Death, the overwhelming amount of death. My entire career, 19 years, has been spent in critical care or ER, and the amount of death and suffering in such a short amount of time is nothing that anyone could prepare themselves for. The heartbreak of having daily talks with patients facing intubation in minutes to hours that are being forced to make decisions on their code status and listening to doctors tell them that once intubated, they will most likely not make it. Literally watching someone face their death sentence and seeing the fear and sadness on their faces is excruciating. Theme of personal mental health. The isolation has been hard. I've definitely experienced some depression, but it's the only way I can be certain that I'm not bringing the virus to my friends and family should I have it, and people dying alone from COVID. Totally drained and deep depression. The theme of separation of patients and families. You being the primary liaison between family and their dying loved one to whom they can't be with daily. FaceTiming deaths of patients. Theme, risk to family. Quarantined from my family, risking my family's health because of my career. Theme, understaffed. Feeling like I cannot properly take care of my patients when we're forced to take more patients than you can care for. Pure physical and mental exhaustion. We go 12 plus hours running nonstop, wearing masks with no time to eat or drink. We're understaffed. There aren't enough CNAs scheduled to work on our COVID unit. No safety companions for patients, rarely a secretary, but we get more phone calls than ever before because we're isolated on the unit. Nurses are expected to constantly answer the phone while we're trying to take care for very sick and scared patients. We're also expected to be able to constantly talk to patients' family members. We feel torn. We care and we want to care for both the patients and their families, but we can't be everywhere at the same time. Many specialists won't come see their patients on the COVID unit. The nurses are expected to drop everything when the specialist calls and basically do their jobs for them while they bill the patient like they actually saw them. It's unethical. It puts more stress on the already stressed nurses. Theme, public indifference. Trying to do everything to save others and my own life, and people walk around with no care, no mask, or nose hanging out of mask. So many deaths and people not adhering to the mask mandates. Theme, the unknowns. The constant state of change and uncertainty about everything. Theme, impact on patients' mental health. This was really represented in the long-term care assisted living nurses. Residents becoming depressed and angry due to isolation. Patients dying, patients not having the visitation from the families because of this virus, has been over all mental and physical changes. Seeing my patient giving up for this reason. This virus has affected everyone. Nurse or patient has been positive or not. My long-term patient being terrified. Theme, sick family concerns. Unable to be with my dad in the hospital. His discharge instructions were horrid. Concerns for elderly parents' health. Theme, personal health. Post-COVID and struggling health issues. The personal struggle with the after effects of COVID for 4 months. When I contracted COVID, my facility made me pay for my sick time by going into the negative on my PTO, causing me to return to work before I feel I was well enough to be providing care. Question 14 asked, what was the most rewarding emotional experience during COVID-19? These top themes were identified. Service, and yet, on the other extreme, nothing. Theme, nothing rewarding. Honestly, I cannot think of one rewarding experience. Meaning and purpose in service. This year has been called the Year of the Nurse. Our profession has once again risen to an overwhelming challenge and made a difference. Being able to make a difference in the lives of my patients and their families remains one of the most rewarding things. Patient recovery. Seeing the patient that went to ICU, the one didn't look like they were going to make it, get better and go home. Gratitude, support, and recognition by others. The recognition and support from our community doctors and families. Teamwork and camaraderie. I am blessed with the best team of nurses that work for me, and we have all come together to pull the weight of each other. Several of my staff have had COVID, including myself and one other provider, and we have made it work together as a team. The last question was asked deliberately by ASNA. How can we best help you in the current environment? Top themes identified from the responses included hazard pay, adequate compensation, staffing and nurse-patient ratios, and adequate PPE. Theme, hazard pay, adequate compensation. Help us get the pay we deserve. We are so underpaid and overworked while everyone is getting funds to continue to spread the virus. Fight for those of us on ground zero to get the same pay that travel nurses are receiving. Raise our wages now. Staffing, nurse-patient ratios. Just needed more help. I did not understand why so many nurses were at home when the cath lab, outpatient surgery, endo, etc. shut down when we needed help. And a unit nurse can't take care of 7 patients, but I can. Wow. Alabama Board of Nursing needs to rule for changes to how patient to nurse ratios are decided at this particular time. The old standards nursing rules are not working. Limit the number of patients we can legally care for. With staff shortages statewide, we are often caring for 8 patients at a time in an acute setting, sometimes with no CNA. It is physically impossible to meet our patients' needs with this type of staffing. Theme, adequate PPE. By making sure we have the PPE needed so we can do our jobs and come home. Theme, employer accountability. Safer working conditions. Encourage hospitals to treat their staff like people. Inspect our area. Leadership does not give us what we need, nor have they set up a safe working area that's sufficient. Require employers to follow the rules. Theme, lobby, advocate for nurses. Keep lobbying for the profession and the safety needs of all healthcare workers. Theme, equipment and supplies. We need more vents, BiPAPs, high-flow oxygen machines. Theme, help with vaccine rollout. Get the vaccines rolling out to everyone in the state. Get more vaccines and more help giving them. Theme, full scope of practice for advanced practice nurses. If we are able to practice without restrictions during a pandemic, we should be able to do the same when it is not a pandemic. There are way too many restrictions on advanced practice in the state of Alabama. Full practice authority without collaboration. It costs over $25,000 per year in collaboration fees and salary. In summary, inpatient and ICU nurses were the most stressed, at risk for burnout, felt underprotected by their employer, and reported being understaffed. Nurses from all areas reported the need for hazard pay, including sick leave that many of them had to compensate for with their own vacation time. Staffing and workload concerns were expressed by many. Many felt undervalued, frustrated with changing policies, fearing anxiety of getting sick or getting loved ones sick. Travel nursing is actually appealing to some because of the compensation. But despite the challenges, nurses in Alabama did find some reward and meaning in service. Thank you for taking the time to view our presentation. Please contact us if you have any questions about this project.